Musculoskeletal pain can be debilitating, right? I mean, I just had a little toe, my little tiny toe. I don't know what I bumped into it, and the pain was excruciating. So we wanted to bring pain management today. How do you do it with chiropractors? So we have one of the leading chiropractors in the country today, Dr. Justin Dean, who is going to join me, and he is the inventor of Neurocentric Approach. So we are going to find out about what exactly is Neurocentric Approach. Hi, good morning, happy Saturday.
Happy Saturday to you. Can you hear me okay?
Yes, perfect, perfect. So I was just
Great.
telling her, yes, I was just telling our viewers that you are one of the leading chiropractors in the country, Dr. Dean, and you are
Uh-huh.
inventor of Neurocentric Approach. So please educate us a little bit what exactly that means. And then the topic for today is visceral manipulation.
Sure. Yeah, I've co-created the neurocentric approach, and I've also created dermal traction method, which is a dermal traction method is a means to treat superficial cutaneous nerves that are entrapped actually in the superficial fascia, also known as the skin.
Mhm.
Those little pesky cutaneous nerves can actually be quite painful and respond quite quickly to treatment. And the neurocentric approach is something that I've created over the last, it's been 10 years now with my mentor friend and second father, Philip Snell, Dr. Philip Snell in Portland, Oregon. And what the neurocentric approach is essentially reprioritizing your assessment, treatments, and intervention to, let's just say, reduce threat to the nervous system. Now, that could be via exercise, that could be via manual therapy, it could be nutritional interventions if you have an inflamed system.
Mhm.
Uh, but really, it's first, before you do anything else, you establish what's the involved neurology
Mhm.
that's involved with the symptoms that they're having, whether it's knee pain, bloating, or headaches, and try to reduce both mechanical and physiologic stress to the system. And so it's a unique system that combines both manual therapy and exercise together, as well as functional neurology concepts, to create a coherent system that's kind of would call it the next evolution of clinical assessment.
That's
Does that make sense?
amazing. I think that's amazing. I mean, I'm not a doctor, so I don't understand, but as a user, I can understand, you're combining all the four different therapies and to really, take care of whatever is wrong and as well as with the pain, musculoskeletal pain. And all these things, they work together integratively rather than as an independent therapies, right?
Exactly. And the key with the way that we're teaching the system is it's not it's not an algorithm. It's not like do this, do that, do that.
Mm-hmm.
Because that doesn't work when you're working with patients quite as much, because every single person is unique.
Mm-hmm.
So we base our diagnosis, our treatment, and our intervention based on getting a positive result. So if we do something and it makes it better,
Mm-hmm.
that confirms the diagnosis, and that's how you treat, versus, oh, let's just try this for 3 to 6 weeks and see what happens. It's no, let's try this for 3 to 6 minutes. And if we get a
Mm-hmm.
positive intervention,
Mm-hmm.
then we have feedback real time on how we progress with treatment. Or if we make it worse, that gives us just as much information. Or if it doesn't work, that gives us even more information.
Sure, sure. So explain us about visceral manipulation and how does it help?
Okay, so visceral manipulation is just uh, a, a method to start to address the organs and the connected tissue specifically of the organs. I mean,
Okay.
we all know that when fascia or muscles or tendons, when they become tight and dysfunctional,
Mm-hmm.
they
Mm-hmm.
start to hurt, and
Yes.
or they can become injured, or they start to suppress the neurology around the area. So your intestines, your guts, everything that holds those things into place,
Mm-hmm.
they're no different.
Mm-hmm.
So it's just that that's the last system from a manual therapy and exercise perspective
Mm-hmm.
that we've been starting to explore, because we were so we spent so much time trying to get to know this red stuff, muscles, and now everyone's trying to get to know the white stuff, fascia, and kind of one of the last frontiers is kind of in your belly.
Yeah.
Now, there's multiple ways of doing that. You can do exercises to address visceral manipulation to vest organs, or you can use manual therapy like we were discussing before. Why is this important? Well, if you take a deep breath in, your diaphragm is like a dome. When you breathe in, your diaphragm depresses, and it pushes all of your organs down. So if there's a restriction, so underneath my hand, there's the liver, there's the stomach, you have the spleen, you have the mesentery, you have all this connective tissue in there, the peritoneum. If any of that's, say, doesn't have very good mobility to allow the diaphragm to depress, then it'll limit depression of the diaphragm. That's a big deal because without proper diaphragm depression, it becomes oblique and it starts to come up, and now your back muscles are going to overarch and you're going to get back pain, or you're going to get poor digestion because that pumping effect is not working. And in a sports medicine world, you're not going to produce as much power because your core is your centerpiece of the body, and if this doesn't depress to create what we call inner abdominal pressure, then you're not going to be as strong. And that's one of the ways that we address knee pain. If you ever wonder, let me backslide just a little bit. And if you want to interject at any time, just go ahead because I can just go.
Sure. No, I think it's fascinating. What is fascinating is what you're trying to correlate the breathing, right? If for whatever reason, if people are not able to breathe the way you're describing, it affects there's a correlation of the digestion, and that's fascinating because yesterday I went to an acupuncturist and she said that my breathing is not as kind of, like the way you're explaining it as it should be. So let's just continue this conversation because I think it's fascinating.
Yeah, so and that's where visceral manipulation comes into play. A lot of people say, "Oh, just breathe down into your belly," but some people struggle with that because if you have a tissue block, like the tissue literally not letting the diaphragm to completely flatten, then you're breathing against a wall, and it's going to be very, very difficult. Not to say you can't achieve it, but it's going to take 12 weeks versus 12 minutes of getting my hands in there. So it's quite a difference there. So with visceral manipulation, it's essentially you are encouraging proper movement of all the connective tissue in there. For example, if the falciform ligament, which is the ligament that connects the liver, and there's a ligament that goes down, it's stability for the liver. If that's too stiff, then your liver won't depress. And you can actually see with abdominal ultrasounds, when you breathe, the organs go down like an inch. It's quite a bit. So I actually do this a lot with babies.
Oh my God, babies, like tiny babies.
Yeah. So when babies are having difficult pooping, going to the bathroom, and it's constant, it's typical for them to get constipated. It's often because the connective tissue, like the primary mesocolon, which is a ligament that holds up your large colon, it's a little too stiff for whatever reason. Maybe it's a developmental thing. Maybe the baby was born a couple weeks early. But if you just get in there and loosen it up a little bit, and it's just a 2 little finger approach, just right on the connective tissue, and then they'll have an instant bowel movement within like 10 minutes sometimes. And for a mom and dad that's not sleeping, that's because the baby's uncomfortable. That's a pretty big deal.
That's huge. So how do you, what is I mean, not that I'm trying to become a chiropractor here, but for our users, what does it entail? Like, that's.
Yeah. So this is not specific to chiropractic per se. There's no pop stuff that we're doing in the stomach. Visceral manipulation is like I mean, I learned this stuff from European osteopaths. most people that are exploring the manipulation of organs are from Europe. There's some Prague and Paris.
Mm-hmm.
Not too much of that going on in the States.
Mm-hmm.
Probably because insurance doesn't pay for it. Who knows?
Yeah.
Like, so how is it done? So it's you have a tight piece of tissue, and there's two ways of doing it. You can either move it side to side, or you can lengthen it and try to pump water into it so that the tissues become more hydrated. Or you can do it with movement. So you can get people in particular positions that stress the connective tissue of, say, more of the liver, and you can push down the rib cage here, create more
Oh.
stretch, and then you can breathe in. And you can create a little bit more localized stretching at particular ligaments. So you can do it with your hands, or you can do it with exercise, getting in different positions. So what kind of conditions does it treat? I'm sure that's going to be a question.
Yes, please.
I haven't seen it. Let me see. There's one question maybe here. I have a lumbar and disc problems in my back. What can you tell to help me? I'm losing. So lumbar disc problems can be related to visceral manipulation because it's not the primary reason. Most of the time it's because you're bending your back forward too much. Like the lumbar discs get hurt with flexion and rotation. So lumbar discs are really easy to fix. It's a movement problem. So you got to change the way you move. And then if it doesn't get better, we'd look at visceral manipulation. But that's a good tangent into, like, for example, last week I had a patient that had low back pain that didn't respond to the movement-based interventions we talked about.
Okay.
And every time she'd be laying on her back, and every time she'd lift her left leg, she would have back pain. Well, I pushed her uterus over.
Oh my God.
And her back pain went away.
Wow.
Actually, I don't know. Maybe I'll share it with you. And so I loosened up the uterine ligaments and everything related to the ovary, and her back pain was gone. And she had it for about a year.
Yeah. Someone's asking another question on my neck always feels better when I do deep yin stretches and myofascial. Oh my God, the question went away. Does fibro affect the lumbar disc? Well, this is an educational session, so doctor cannot talk about personal issues here, but maybe on a general level, you can just guide the users. I think they've been patiently waiting to ask you questions. Yeah.
So, I can't say specifically about fibroids infecting your disc, but in general, it's still 99% of the time movement-based issue. But you really need to look at how you pick up things. If you're bending forward in your back, how you get up and down from a chair every day is more relevant. It's not to say that the fibroid isn't affecting the mechanical the mechanical properties of the connective tissue that attaches to the low back, which makes you more likely to. But that's not the first thing the first thing you should do: movement retraining, and like things like a prone press up. You can look that up on YouTube. It's pretty easy. Those are the more appropriate ways to treat a disc. Yeah.
Okay. All right. So what other things that you like to add before we wrap up?
Well, related to visceral manipulation, there's like the things that I like that I think really important is that most people don't realize how important the midsection of the body is.
Yeah.
So, like, how many people have seen a power lifter use a weight belt? And everyone thinks that that's for, like, it's preventing someone from their spine buckling. But we know from research it doesn't prevent movement of the back. What it does is it gives a feedback cue to the core to push out. So you breathe in, you create pressure, your core comes out, kind of like a little baby, like a little fat baby. And that creates maximal stability of the back, and that's how you can lift a lot of weight and protect your back. That I bring that up gives you a visualization of how much pressure and stability you can create for the system there, versus that belt's not doing that much. It's just reminding you to push out against it, and it's giving resistance. Kind of like if I want to move away from this tree, I'm pushing the tree away.
Yeah. It's fascinating, the type of work that you're doing, and you know, I don't think a lot of people understand about the visceral manipulation, you know, the impact that it can have in a positive way to the organs that you're describing and how it's interconnected, right? I think it's fascinating. Anything else you'd like to add before we wrap up? If someone has a question, you know, that's related to what we are talking, please go ahead. We can take 1 or 2 questions. Is that okay, Dr. Dean?
Yeah, sure. I plan for half an hour. See, half an hour.
Okay. So if anyone has any particular question, you know, related to the topic, please let us know. Anything else that you would like viewers to understand or know about?
Well, let's see. Where are your viewers mainly from?
They're from all over the world. Yes, they are. Well, we have viewers probably from US, UK, India, and then of course your viewers. So I would say these 3 countries. And I think the concept of visceral manipulation of the chiropractor, I don't know how prevalent it is in the other parts of the world. Definitely in this, you know, in US, we all understand the chiropractic care.
Right. So chiropractic care is just standard chiropractic care is just basically adjusting the joints to increase joint mobility and to decrease, like, you know, pain, that sort of thing. For me, I'm much more than just that kind of chiropractic. You could call it a full spectrum therapist. I do everything that's within my scope.
Yes.
So yeah. So, I mean, let's see if there's any questions. Besides if I'm married or not. Yes, I'm married.
I know. That's what I said. Please direct the questions that are related to the topic and not personal. So, I mean, you know, we like the humor here, but the questions have to be particular to. So we talked about what exactly is visceral manipulation, how can it help you, what are the different conditions. Dr. Dean demonstrated a little bit as to how it's performed. If there are no more questions, thank you so much. I think it's an amazing work that you're doing, and more people need to understand the importance of the work that you're doing, which all of us don't understand. So that's why we wanted to bring someone like you and explain us exactly what it means and how it can help a lot of other people.
Yeah, so it's a powerful tool, and unfortunately, not that many people do it yet, because I mean, the anatomy of the abdominal cavity is it's not linear like the rest of the body. It's like point A connects point B to C, and it's kind of like in a star, and it's not. I mean, it's complex, but when you get into the abdomen, things are much more complicated. You can't pin something down with your finger as easily, so it takes a skilled manual therapist. But the only thing I'll say from here is that if anybody related to the disc questions or anything else, I try to write helpful articles. So I have some helpful articles on my website, drjustindean.com, and any clinicians in the room, I will start teaching the neurocentric approach as soon as the world seems to get back to sort of normal.
Yeah.
So that you can sign up for the newsletter at neurocentricapproach.com. And yeah, so I think that is about it.
Yeah. Thank you so much for all the viewers. Understand visceral manipulation can help you, like Dr. Dean talked about that. And then, someone's asking about dark circles. We're not really talking about dark circles, so please keep the questions particular to the topic. We bring all kind of topics. Check us out on FB Live as well as IG. We have topics coming every single day from all the gamut of all the health concerns that we can think of. With that, thank you so much, Dr. Dean, for being with me. Really, truly humble and appreciate your gesture of educating the viewers about these important things. Thank you.
Anytime. And if you want to talk about a different subject sometime, let me know.
Yeah, I would love that. Someone's asking a question. Let's just DM us right now. We cannot go into the details of each and every client here. So please honor this request. Thank you so much.
All right, thanks.